here somewhere at Palm. It started when I was in my final year. That was 2002. So as time went on, I started failing my exams. So I started fasting and prayer. So I prayed and fasted for more than 1 month until the problem persisted. I can't sleep. I can't sleep in the night. When I woke up I'll be staying there without sleeping. So it happened for many days. I came home 3 days later. All over my body became uncomfortable. I'll be there and then something will be like a catalyst on me. I'll be there and something will be like some bones above me trying to kill me. Sometimes I won't sleep. I'll be there till the next day. I was in a dilemma situation. I didn't know where to find myself, what to do, and then so I was confused. My uncle took me to another Jew man again. So he sold me some medicinal leaves, which I used. So after squeezing the liquid and drinking it, I restored my blood. Still, the problem persisted. I told my uncle that because I'm a prayerful man, I won't stay here for Jew men to be taking my money. So I have to go to a prayer center. So I went to a prayer center, and the pastor there told me to fast for 5 days. That is dry fasting. So I did the fasting. And after the fasting, 3 hours later, I had the attack. So my uncle and a brother requested me from the pastor and brought me home. When they brought me home here, it became a problem. And then my father said, because I'm not stationary, they should make sure they confine me. I was just chained up in the room. And then I seated there. I urinated there. I ate there, everything. Sometimes you'll be there and they will come and then beat you up. They use stones and other things to beat me up. That if they do that, I will be totally healed. The stones will also cause injury in my body. So I feel severe pains in my body at that time.
Samuel's mother tells of the tragic series of events that befell the family, with Samuel in chains and his sister suffering epileptic fits.
I'm going to find a cavalora, Obaba, Quentin, you eat a liquor. I put a son of a band, a Samuel and a band on pan. Uncle young Moria. Ompia will let you buy your knuckle carabel soon, cold egg, salmon and cup of biscuit. Come on, knock tea, ma'am, team tis on your noon. Kabila nuka bis, come on your dim for your colleague. Da cannot open no new woman open yard.
For a nation of nearly 30 million people, there are only 26 qualified psychiatrists. That is a ratio of 1 psychiatrist to 1.15 million people.
To a large extent, mental health was neglected, even within the health service system, where mental health care services were virtually an afterthought.
If you look at, let's say, the 3 psychiatric hospitals, they're all located down south, within 3 hours drive of one another. So up north, Kumasi upwards, we don't have any such facility.
There are just too few psychiatrists in the country. All of them are either in Accra, they are in Kumasi, or they are in Cape Coast. About 24, 26 of them.
We don't have a psychiatrist in the region. And scarcely do we get psychiatric outreach also in the region. So the doctor-to-patient ratio, I don't even know how I'm going to quantify it because already we don't have.
I'd say there are 3 main challenges to mental health care in Ghana: a lack of funding for mental health and shortages of psychotropic drugs, mental health services that are limited to old institutions for those with severe psychiatric illness, rather than mental health being seen as integral to the health and well-being of all people and mainstreamed into community health services.
When people face mental illness or mental conditions or problems of any kind, because in the country currently the access to mental health care is not readily available and not readily accessible, people would rather go and see a fetish priest or a traditionalist at a nearby prayer camp. We have realized that these people, faith-based healers, are readily accessible to people, and so from time to time they've been the first point of call.
It was into this difficult situation that Basic Needs began its work to bring mental health care to remote and underserved communities.
Our strategy was basically to generate demand for mental health care services and to facilitate the supply of mental health care services. So letting everybody know that mental illness is treatable and that there are services or very adequate treatment services available for people, and they are encouraged to access those services.
So it's on the A1 Radio 101.1 FM, and it's Working Happiness Watcher with me, Kofi Asante, and it's all about mental health.
Alright, if you just tune in, this is KSB 107.1 megahertz, the power behind the beats, right here in the city of Tamale. And this afternoon we are discussing mental health issues.
Mental illness is something that has not been given that much coverage. And so we needed to put it out there through Basic Needs for people to understand that it is a problem that we have to deal with.
As media practitioners and as a member of Mental Health Alliance in this particular region, we make sure that we use radio to sensitize people.
When we started the education programs and then getting some of them that have recovered coming on radio to share their stories, some of them even testify that after they listened to the programs and then also the awareness creation, it helped them.
Our programs had improved as a result of the training I had from Basic Needs and then Mihusu regarding issues about mental health and then maternal mental health, because these are areas that
we made our services community-based. Our focus was developing a community-based mental health care system integrated into general health care, working with a cadre of community volunteers who served as linkages to these community psychiatry units. So the nurse alone may not be able to go throughout the communities identifying who has a mental health care need.
Mr. Abubila is a community volunteer who works to bring health information to the remote communities in the Binduri district of the Upper East region. He first heard about Samuel Apam's situation and came to his aid.
Basic Needs, one of their models is a consultation. We called a consultation meeting at a community called 44. Then the mother heard that it was announced that people with mental illness and their caretakers should come for a meeting. After the meeting, the mother came to me and consulted me that she has a son who is suffering this condition, that right now she's even caned. So after I told the mother that I'll come, I asked of the house, she directed me, I came a day after.
I don't want to see my mother.
I came and met him in chains, and I felt for him.
In Savelugu, Idi Sadiq, another mental health volunteer, meets with members of his self-help group. This is a support group created under the Basic Needs model to facilitate mental health care in clusters of communities.
In Savelugu here, in fact, formally, you will see more psychosis patients just going round, up and down. I had one woman running up and down, passing to this place, passing to up and down, with a naked, just a small crack. that old lady just listen. And now the woman, if you see her, you will say, even you will just say that it's a hajia. So there are more of them, not only one person. Not only one person. Formerly, if you see them, in fact, you will know that even they will be a proper human beings again, but now they are okay.
The importance of the self-help group is the one, it brings them together as a group, as people with common conditions. They are able to discuss issues about themselves and how to support themselves to come out of the difficulties each member is facing.
The group was created so that treatment will be easy. If we can get the groups, many of them at one place, for the only one nurse to come and meet them and give them education and treatment. If they are not brought together, the only one nurse will not be able to go door after door to look after them. And when they are brought together, they look at their numbers and they think that, oh, I'm not alone. If you are in the house, you think that you are the only one the problem is facing. But when they come together, hey, this man is also like this. Oh, so this man, look at our number. Then thank God I'm not alone. They feel good.
Recently I visited Tamale with British High Commissioner to see work on the ground, and we visited a mental health self-help group near Tamale. It was a great experience for us in terms of meeting with people with mental health illness and their carers, and to see how Basic Needs has helped them with UKAID support. It was great to see UKAID in action.
Faith-based and traditional healers are often the first point of call for sufferers in rural and out-of-reach communities.
In the past, people would go there and be chained and be asked to fast because of the perception about mental illness. But now, gradually, that kind of practices are stopping and reducing.
Basic Needs has made us to collaborate with the hospitals. And as at now, at certain times, when you have an aggressive mental patient, when you call the psychiatric nurses, they come in for our aid, either to give that patient's injection, or even at times they give you medicine that you'll be giving to that patient. So Basic Needs has helped us a lot, and we think it is improving our work.
A critical aspect of mental health service delivery required that Basic Needs work to strengthen the capacities of the health services.
On the supply side of mental health was to actively engage with the health system of the country, the Ghana Health Service as the National Health Service Agency, to begin to address service needs of people. What we realized was that even the basics of mental health for general nurses was non-existent. A nurse saw himself as a ward nurse and has nothing to do with mental illness. We first had to do this engagement to reorient the health system to take on board mental health care services.
We have to train them, sharpen their skills on how to recognize and treat mental conditions, give first aid, and then refer appropriately to the psychiatric nurses to continue.
These are people who are likely to come into contact with the patients first in places where there are health facilities but there are no psychiatrists.
The training started in February and ended in March 2015 in the 3 northern regions and then Brong Ahafo region.
These people have been trained over and over again, and from time to time I'm called upon, for instance, to render training to some of these nurses, and after even the first training we go back for recap and for refresher programs for them, etc. So
then followed up with complementing with logistics, provision of vehicles, including motorbikes, for outreaches.
Usually it is Basic Needs who sometimes support us with outreaches. Maybe they'll bring a psychiatrist to the region to conduct outreach for us.
I have been able to visit some of these parts of the country because Basic Needs sent me to run these specialized clinics, and it's been the outcome has been really enormous. When you go and you listen to the history of people who have lived with several forms or different forms of mental illness, neuropsychiatric problems, epilepsy, for instance, for years, 20 years, 15 years, and then they tell you that you came to see them maybe 3 months ago, you gave them medication, you go back, and for the first time in their lives, they've never had a seizure or they've never had an aggressive behavior in 3 months. It's amazing, and that is very rewarding for some of us because that is the job, and that is our job, and that is the kind of feedback we expect.
When Basic Need comes with a specialist, usually they stay for 5 days, and we do 5 districts. And last year, I think they came twice. And we did 5 days, 5 districts. Then the other outreach again, they will come 5 days, 5 districts. So I think that supported us, looking at 27 districts that we have. So we've been able to cover 10 districts with outreaches.
The health facilities there here actually meet the needs of mental health patients simply because of basic needs interventions. I am aware that Basic Needs have provided 2 motorbikes for mental health activities. They also provide drugs and the necessary equipment to the Talensi District Hospital in order to address the needs of people suffering from mental health. They have also gone further to even provide funds, particularly in an area like Bare, to refurbish the clinic or the hospital that is there. So they are doing a lot.
I can say without Basic Needs, mental health in Northern Region would have been a disaster. Ever since I completed, from 2005 to now, I came and met them already. They came into being in 2002, and they have been supportive in terms of even the drugs. They are very supportive. These drugs you see here, that is the last consignment we had from Basic Needs.
Basic Needs in particular, unlike many other NGOs, or almost all NGOs, started and still has its headquarters outside Accra. All other NGOs, their headquarters in Accra, so from Accra they move. Their headquarters is in Tamale, and from there it's working its way gradually to come to Accra. So it's taking care of the community level care, which we have not been able to adequately reach because our resources are limited, and so we are constrained to be within the cities. So Basic Needs is doing that. But it does that not alone. For instance, Basic Needs is by nature not a service delivery NGO. It's more for promotion, for training, and advocacy. But they manage to facilitate and get specialists to go to underserved areas to go and offer services. Where you don't have medications, they will buy medications for them. So by this, at least once every 3 months, those areas where they are working, somebody there would have seen a doctor, a psychiatrist. Somebody there would have at least once a month, 3 months, had medicine. And that is helping a lot.
Over the 16 years of Basic Needs work in mental health, many gains have been made.
Well, the state of mental health care for now is improving, I would say. Until recently, if you ask me on a scale of 10, where would I put it? I would put it at 2 over 10. Now, on a scale of 10, I would say maybe 4, getting to about 5 over 10.
The health service is better positioned to deliver mental health services.
We are talking about close to 155 district facilities that have a mental health unit, at least staffed with a mental health nurse to look after people with mental health care conditions. We are talking about district assemblies that are now beginning to provide budgetary allocations for mental health in their assembly plans and budgets.
With the establishment of the Mental Health Authority and the draft legislative instrument, the policy framework exists to improve mental health services.
In terms of policy development, they have been very well advocating Sometimes because we are governmental people, government won't listen to us. They come in from non-governmental section and they speak, and then the government listens. So the passage of the law, they played a major role advocating. I remember we were writing articles, I was writing a lot, they were writing a lot in the papers. There were sometimes physically we go and meet with the minister. So they did a lot of advocacy and they continue to play advocacy role. So advocacy, lobbying, health promotion, prevention, and indirectly service delivery, and they're doing that very well.
Basic Needs could not have made such an impact on mental health without the collaboration and support of various organizations. It would like to thank the British government for its immense funding support to its work.